The old gives way for the new at this PTF briefing, as the Minister of State for Health abolished the previous 5,000 naira paid across board to health workers and announced new incentives negotiated with healthcare unions.
A special COVID-19 hazard and inducement allowance of 50% of the consolidated basic salary is to be paid to all health workers in federal government teaching hospitals and federal medical centers to last for the first 3 months in the first instance. B, 40% of the consolidated basic salary will be paid as special COVID-19 hazard and inducement allowance to health workers at special non-public hospitals and clinics. In the interim, government agrees to grant extension of service for a period of 3 months in the first instance for health workers retiring within the COVID-19 period.
As part of the latest incentives, health workers directly managing COVID-19 cases at isolation and treatment centers will get additional 20% of consolidated basic salary as special risk allowance, while non-core medical professionals will get 10% of their basic as risk allowance. The trend of multiple deaths in Kano State continues to be a major concern to the Presidential Task Force.
The federal government, through the Federal Ministry of Health, is deploying a high-powered fact-finding delegation to work with the state to improve COVID-19 response, as well as ask questions on the causes of these deaths reported.
To find out what is going out, to take samples, to send them into the lab, I have to trust the work that they do, and you have to trust that the work they're doing on your behalf.
State governments involved in repatriating Almajiris to their home states were advised to consider their security and welfare.
If we do not deal with the issues relating to the Almajiris, we are building an army that would overwhelm us as a people and as a nation in the future.
I don't know how we can divert Empower funds for the COVID-19 response on palliatives. That is another fake news.
With 2 more molecular laboratories activated in Sokoto and Zaria, the Nigeria Center for Disease Control says it is in talks with reputable firms to scale up COVID-19 testing capacity in the country. In Abuja, Mitaire Ikpen, NTA News.